If you've ever been woken up at 2 or 3 in the morning with your calf suddenly locking up so tight you can't even put your foot down, you already know exactly how miserable it can be. And here's the surprising part. Maybe you've heard it's dehydration. Maybe someone told you to take magnesium. Maybe you've just accepted it as one of those things that happens as you get older. But none of those explanations tells the whole story. In this video, we're going to break down what actually causes nighttime leg cramps, what you can do the moment one hits, and which warning signs mean you shouldn't simply ignore them. Here's the honest truth. Nighttime leg cramps usually don't come from one single cause. There are several things that can be going on at once, and in most cases, even a medical evaluation may not identify one exact reason for a particular person's cramps on a particular night. That might sound frustrating if you were hoping for a simple answer, but it's actually useful information because it means you don't need to keep hunting for the one hidden cause everyone online claims to have found. Instead, let's walk through what we actually know and then get into exactly what you can do about it. First, what's happening in your body when a cramp hits. A cramp is a sudden, involuntary contraction of a muscle. Researchers believe abnormal activity involving the nerves that control the muscle plays an important role, although the exact mechanism isn't completely understood. It's uncomfortable, sometimes painful enough to leave your leg sore the next day. For most people, an occasional nighttime cramp isn't a sign that something serious is going on, but that doesn't mean there's nothing behind it either. It's simply that the exact trigger on any given night is often hard to pin down. And that's true even for people who eat well, stay active, and take good care of themselves. So what tends to be involved? A few things come up again and again in research on this. Changes in muscles and tendons with age may contribute to the higher frequency of cramps seen in older adults. Muscle fatigue from being more active than usual, or from being unusually inactive, can also play a role. Sitting for long stretches during the day is another factor that's been associated with more cramping. Dehydration has been linked to cramps too, though it doesn't explain every case, so don't treat it as the whole answer. Certain medical conditions, including diabetes, thyroid problems, and certain nerve or circulation problems affecting the legs, have also been connected to a higher chance of cramping. None of these automatically explain your cramps specifically. They're simply pieces that researchers have found tend to show up more often in people who experience them, which is exactly why there usually isn't one tidy explanation. And that's exactly why. The most popular explanation, magnesium deficiency, deserves a closer look. Magnesium plays a real role in normal muscle and nerve function. That part is well established. But for ordinary nighttime leg cramps, magnesium deficiency is not considered the usual explanation, and supplementation has not consistently been shown to prevent or relieve them. That doesn't mean magnesium is irrelevant to your health overall. It plays an important role in the body. It just means you shouldn't assume that a bottle of magnesium off the shelf is a proven fix for cramps at night. And please, don't start taking large doses of any supplement just because someone online insists your cramps must come from a deficiency. If you're curious whether it's worth exploring for you personally, that's a conversation for your doctor based on your own health history. You may have heard that a normal magnesium blood test doesn't tell you everything about your body's magnesium stores. That's true as a general limitation of the test, but it doesn't mean you should assume you're secretly deficient. If there's a concern, Your healthcare professional can interpret the result alongside your symptoms, medical history, diet, and medications. It's also worth knowing that some medications, including certain cholesterol and blood pressure medicines, can be associated with muscle cramps or other muscle symptoms. That doesn't mean your medication is the cause, and you should never stop or change it on your own. Ask your doctor or pharmacist to review it in the context of your symptoms. They're in the best position to sort out whether something you're taking is playing a role. So if it's not automatically magnesium and it's not one single cause, what should you actually do when the muscle locks up in the middle of the night? Let's get into that, because this is the part that actually matters when you're standing there at 2 a.m. in pain. When a cramp hits, remember 3 things: stretch, gently move, and don't force the muscle. Start by gently stretching the muscle that's cramping. For a calf cramp, that usually means straightening your leg and pulling your toes and foot up toward your shin, holding it steady rather than forcing it. If it's comfortable, try standing up and putting light weight on that leg, or walking a few slow steps. Keep the movement gentle rather than forcing the muscle through the pain. A warm towel or a gentle massage on the area afterward may help it settle down once the sharpest part of the cramp has passed. These approaches may help the muscle relax and make the episode easier to manage, but there's no guaranteed instant fix. Now, knowing what to do in the moment is only half the story. What about reducing how often these cramps show up in the first place, to reduce the chance of future cramps? Focus on 3 things: regular stretching, reasonable hydration, and avoiding sudden changes in activity. Regular calf stretching is worth trying, although the evidence that it consistently prevents future cramps is limited. Staying reasonably hydrated throughout the day is a simple, low-risk habit worth maintaining regardless. Some people also find it more comfortable to keep bedding loose around their feet at night, so the ankle isn't held in an uncomfortable pointed position for hours. Avoiding sudden jumps in activity, like a much longer walk or workout than you're used to, may also help, since overworked muscles seem to cramp more easily. And if you're on medications, it's worth asking your doctor at your next visit whether any of them are commonly associated with cramping, simply so you have the full picture. Start with the simplest habits first and pay attention to whether your cramps become less frequent or less disruptive. Now here's the part I really want you to pay attention to. Occasional nighttime leg cramps are usually not a sign of a serious problem, but there are times when cramping deserves a real conversation with a healthcare professional rather than being brushed off. If your cramps are happening frequently, if they're unusually severe, if they're new and you haven't dealt with this before, or if your sleep is being seriously disrupted night after night, that's worth bringing up at your next appointment. The same goes if cramping shows up alongside other symptoms like muscle weakness, numbness, swelling, skin color changes, persistent unusual pain, or trouble walking. And there's one distinction worth being especially clear about. If you develop sudden swelling, warmth, redness or discoloration, or persistent pain in just one leg, don't assume it's a nighttime cramp. Get medical advice promptly. And if that happens together with sudden shortness of breath or chest pain, treat that as an emergency and seek care right away. I'm not saying any of this means something serious is wrong most of the time. What I am saying is that these particular combinations of symptoms are best evaluated by someone who can actually examine you, not diagnosed from a video online, no matter how thorough that video tries to be. I know it's tempting to want one clean answer, one supplement, one simple fix that explains everything? I wish it worked that way too, especially at 2 in the morning when your leg feels like it's on fire and you just want it to stop. But the honest picture is that nighttime leg cramps usually involve more than one contributing factor, and sorting out your particular situation is something worth doing with a professional who knows your health history, not something to figure out from a single video. What you can control is this: knowing what to try in the moment, knowing what habits are worth experimenting with, and knowing which symptoms mean it's time to stop guessing and get checked out. That's the real takeaway here, and it's more useful than any single miracle cause a video could hand you. So let me ask you this: when a cramp wakes you up, where does it usually hit you? Your calf, your foot, or your toes? Let me know in the comments below. I read every one of them, and it genuinely helps me figure out what to cover next for you. If this video gave you a clearer answer than the usual just take magnesium advice, consider liking the video. It helps us reach more people who are dealing with these cramps at night. And if your legs don't just cramp at night but also feel weak or unusually tired when you're walking or getting up from a chair, that's a different problem worth understanding. I made a video specifically about that, and you can watch it right after this one.